Hi there. I just want to spend a few minutes with you today to give you some more detail about the QI checklist versus IRB application. Try to make this brief and just give you some more pointers about this. Some of what I'm going to tell you is maybe a little bit of a reiteration of what I said in the opening video, the orientation video, and the discussion early on. But now that you know a little bit more about your projects and about the project proposal process, I just want to tell you a little bit now about QI checklist versus IRB application. So let's talk first about what is the purpose of IRB. The IRB is the Institutional Review Board, and all universities and any place, anybody that's going to do research typically has to go through some type of an Institutional Review Board, or IRB, or some type of ethical oversight committee, and their purpose is to protect human subjects. And so I won't go into all the detail about why that's important, but hopefully you all know of the past history of potential human subjects that were abused, or there were problems because the proper IRB oversight didn't occur. So the IRB is very important, and as students of the Medical University of South Carolina and the College of Nursing, you certainly fall under the oversight of the MUSC IRB. However, we were able to get the IRB to help us develop a QI checklist that they approve of. And this QI checklist, when you go and look at it, there are questions, and there's a true or false answer to each question. And so the purpose of the QI checklist is that most of our QI projects that students are doing should qualify for QI checklist, meaning that you and the faculty member can answer yes or true to each of these questions. And if that ends up being the case, then, and you qualify for the QI checklist, you don't have to apply to the IRB for approval. So let me explain in a little bit more detail why that's so important. So anytime you apply to the IRB, you have an IRB application for your study. Anytime you do that, it takes time. Believe me, there are three main categories of IRB projects. There are exempt, expedited, and full board review IRBs. Exempt is a misnomer. Nothing is exempt. What it means is you apply to the IRB for something you're doing. You're looking at retrospective data, and you're not involving human beings whatsoever, but you still are applying to the IRB because of the project involves a lot of data, perhaps. There are different reasons why, so in that retrospective data, maybe you're still looking to explore some gap in knowledge, and once you do that, then you want to publish the results, and you want to publish those results as what's called generalizable knowledge. For generalizable knowledge, you want to publish it as a research study that was done, even though you may not have used any human subjects. You were only looking at their previous medical records and that sort of thing. That would still have to go through IRB approval, but it would be considered an exempt study. But it still takes time, believe me. The category of expedited is a misnomer. Nothing is expedited with the IRB. It takes at least a month to 2 months, even for the easiest of projects, for them to approve or to approve, to give you the go-ahead. So don't be fooled by the word expedited. And full board review is really 3 to 4 months or longer. So our goal is really to try to help you avoid having to apply to the IRB and go through that process. And how is it that you do that? We want you to try to ensure that your project is a quality improvement project. And quality improvement, evidence-based practice quality improvement projects is something where you develop a standard of care based on the evidence, some type of standard of practice that you are going to implement in a practice site, a primary care site, a nursing unit, a hospice unit, whatever it might be. And but you're going to implement this as a standard of care that everybody is going to get. So you're not selecting a group of patients and then just trying it out on some people. You're saying that we're going to implement this as the new standard of practice in this area. And the data that you hope to gather is hopefully, even if you're going into patient records to extract something, still what you're trying to do is to pull out aggregate data so that you're not saying that John Smith had this at this point, and then we're going to look at John Smith afterward and see if we made an improvement in John Smith. That's not aggregate data. That's patient-specific data. And anytime you're going to use patient-specific data, you're going to have to go through IRB application and gain their approval. So that's what we mean by aggregate data. You have to. It doesn't mean that you can still go and get the data, but you're going to pull it, extract it, and just put it together so it's just numbers, and you're not going to use any patient identifiers whatsoever. And so that is one way in particular to make sure you have a quality improvement project, as opposed to a research study, which a research study is, and even a quality improvement project aimed at individuals may not always be research, but if it's aimed at individuals, in other words, I'm interested in obesity, and so I'm going to take 20 patients and measure their BMI, and then I'm going to implement an educational process and teach them about diet and exercise or something, and then afterward we're going to look at their BMIs. That's patient-specific data. That has to go through the IRB and get approval through the IRB. Now, we don't say you cannot absolutely categorically do a project like that. It's just much more difficult for you to have to do that as students. So with the volume that we have too, see, it was much more difficult on the IRB to have 50 projects coming at them once we got through approval process, which is why they agreed to help us with the QI checklist. So the other thing that's always been said in the university, in most universities across the country, is if you're going to publish results, you have to get IRB approval. And that's been true for many years. However, we're able to bypass that because what we say is when we want you to publish, we want you to publish that you did a project in a site, and here's the results of that project in that site. It was a quality improvement project done at that site. We're not trying to contribute to generalizable knowledge. We're not necessarily trying to say, okay, folks, here, you try this at home. You go and try this too, and you should get the same. We're not trying to say any of that. All we're trying to do is to report on the project that you conducted, how it went, and what were the results for your local site. And so the IRB was very gracious to say, if you can guarantee us, if you can say, and you and the faculty member, student and faculty member can go through the checklist and say, we are not going to publish this with the intent of contributing to generalizable knowledge. Everything we do here is a quality improvement based on evidence. So we're not trying out something that's never been tried before. That's why we tell you have to have evidence. We don't want you inventing something and trying something out. So that's how you get to make sure that you're able to use a QI checklist versus having to go through the IRB. And you will have to go through the IRB if your project in some way you are going to gather patient-specific data and follow patients post-intervention. Again, let me reiterate, there are a few projects that I've seen already described which, they're good projects and they make sense, and but they are going to try to follow patients, post-intervention to look at some results, and in that case, I will help you get through the IRB process, but you will have to go through the IRB application process if in any way you are following patients post-intervention and trying to look at pre-intervention, post-intervention data that is patient-specific. So I only want to spend a few minutes here. I'm less than 10 minutes, and I don't want to spend much more time, and hopefully this may pique some questions from you if you have more questions. But last semester, 2 semesters ago, I think, I didn't give this little brief talk until later in the class, and then I had some people who said, boy, I wish I'd known that earlier, so that's why I'm trying to give this information to you now. So hopefully you understand that's a little bit about the QI checklist versus the IRB application process, and you can talk to your faculty member further as you are developing your project to see, am I on track for being able to use the QI checklist, and you can also email me and I will try to give you pointers as well. But hope this was helpful, and hope things are going along well for you. I'm pleased with our progress so far. Hard to believe it's February already, so and certainly looking forward to seeing all of you here in April as we rapidly move forward in this project proposal process. Thanks a lot for listening.